Hi, I'm Ernie Conwell. Please join me, the National Football League Players Association, and the William W. Backus Hospital in our efforts to educate coaches, parents, and players about concussions. By watching this video, you will learn what a concussion is, how to recognize a concussion, and what to do if you or a teammate has suffered a concussion. And remember, reporting a concussion and treating it correctly will keep you in the game longer.
Hi, my name is Dr. Anthony Alessi, and I'm a neurologist here at the William W. Backus Hospital. I specialize in the area of sports neurology. Concussion will affect as many as 3.8 million athletes this season alone. We're especially concerned with what are called high-velocity collision sports, things like football, hockey, soccer, and lacrosse. By paying close attention to this video over the next 10 minutes, we hope to give you valuable information that will avoid serious head injury in yourself and your teammates. Throughout this video, we're going to be referring to the 3 R's: recognition, rest, and recovery. Before recognizing a concussion, we need to define it. A concussion is best defined as a syndrome of immediate and transient neurologic impairment or neurologic change that occurs as a result of a biomechanical force. Typically, that biomechanical force is a blow to the head. Once the brain is struck, changes occur at a cellular level. At a cellular level, there is a rush of calcium into the nerve cell. That calcium causes swelling and damage. One analogy that we're going to be using as well is that of a flood in your basement. First thing that occurs is there's a breach in the wall of the basement. There's some crack and water begins to rush into the basement after a storm. The storm being the blow to the brain and the water being the calcium rushing into the nerve cell. The body then, much like you in your basement, must recognize this breach or crack early. The sooner you recognize the crack and the water beginning to flow in, the quicker you can take action to stop this flow. That's why it's important to recognize a concussion early. Once the water starts to rush in, the only way to get it out is by using a pump, and that takes energy. Some of the early signs of this breach of the wall or this blow to the brain and concussion include nausea, vomiting, drowsiness, a vacant stare, confusion, loss of consciousness, mood changes, and uncoordinated or unsteady gait. Failure to recognize these signs of concussion leaves an athlete vulnerable for a second head injury. Again, if you're looking at the analogy of flooding your basement, it would be like having another storm strike before you were able to do repairs on the first storm. When a second storm hits or a second blow to the brain occurs, irreparable damage to the brain and the ability for it to function may occur. Now that we've discussed the importance of recognizing a concussion early, let's talk about rest. When we think of that pump working so hard to pump calcium out of the cell or pump water out of your basement, it requires an expense of energy. So the brain and the human body must divert energy from other organs and other efforts so that the brain can function and use these pumps effectively. The way the brain preserves energy is to go to sleep. That's why you see when someone has had a serious head injury, they'll often lose consciousness. This is the brain's way of saying, I need to rest and need to take care of repairing this damage. That's why it's not only important to take the athlete out of the sport, but then allow them sufficient time to rest. That means avoiding things like reading, television, video games, texting, and getting as much sleep as possible, or at least as much sleep as the body demands, before returning to any activity. Some of the symptoms an athlete will experience during this rest phase include headache, fatigue, amnesia, dizziness, vision changes, poor balance, light sensitivity, sound sensitivity, changes in sleep patterns, and difficulty concentrating. It's not until all of these symptoms are cleared with adequate rest that we begin the phase of recovery. I'm often asked, how do you know when an athlete's ready to return to their sport? That brings us to the third R, that being recovery. An athlete begins the recovery phase when they have no further symptoms that I previously mentioned and are able to perform normal activity. The best analogy is the cleanup phase. After the flood has occurred, you've pumped all the water out of the basement. Now you need to begin the cleanup part. There's no specific diagnostic test that tells you when that phase should begin. You really must trust the judgment of a qualified medical professional who spends a lot of time treating patients with concussion. These are typically physicians who are actively involved in sports. The recovery phase typically involves a graduated return to sport. This is done under the guidance of a certified athletic trainer or a licensed physical therapist. The first phase is light aerobic exercise, using a stationary bike, walking on a treadmill, swimming. Next, sport-specific exercises. So taking your sport and starting to do some of the activities. For example, in football, beginning to do sprints, beginning to do cuts from side to side, or in hockey, getting back on the ice and sprinting up and down the ice. The next would be no-contact drills, becoming involved in your sport, but wearing what we call the red jersey, so that there is no contact and you're able to run through plays. Finally, full contact practice and return to play. None of these stages should be initiated until an athlete is entirely symptom-free under normal activity for at least 3 days. The recovery phase can take days, weeks, or months. In some sad cases, there's never full recovery and return to sport. On this video, we've discussed the 3 R's of concussion: recognition, rest, and recovery. Don't fall into the trap of not reporting a concussion for fear that you'll lose your time in the game or lose your position. Remember, reporting a concussion and getting the correct treatment quickly will keep you in the game longer.